What is a SCPOR Learning Health System project? Well, what is a learning health system?
A learning health system is designed to make improvements to the health system in two key ways. First, by bringing together key stakeholders to increase health system efficiency, and second, by encouraging stakeholders to work together to form improvement cycles. Key stakeholders included in a learning health system or learning health system project include patient partners, which includes family members and community members, clinicians or care providers, such as doctors, nurses, and pharmacists, decision makers, such as healthcare administrators, elected officials, band council members, and representatives from non-government organizations, health system representatives, which includes anyone working within the health system, such as policymakers, as well as staff like quality improvement personnel and research scientists. And finally, academic researchers, such as researchers from the University of Saskatchewan, University of Regina, First Nations University of Canada, and Saskatchewan Polytechnic.
The three phases of a learning health system. Practice to data, where data about healthcare is collected from providers, patients, and the system. Data to knowledge, where people work to understand data and find areas for improvement. Knowledge to practice, where understandings are used to improve the health system.
There are a number of advantages to a learning health system. These include the ideas that rather than engaging patients as research participants, patient partners are engaged through all aspects of the project. Rather than interventions or implementation of interventions being suggested to the health system by researchers, the health system is involved in research, which makes it easier to implement. Rather than research ideas and projects coming from outside the health system, researchers work within the health system to address system priorities. Rather than data being collected by individuals from outside the health system, that data is automatically collected by the health system. And rather than going through a lengthy or difficult process to get access to data, that data is accessible to providers and patients.
SCPOR supports include SCPOR staff with expertise in the areas needed to complete the project, like research scientists, data analysts, project managers. Each team can request the equivalent of 4 full-time employees to join their team and contribute their expertise to the project. Value of SCPOR supports. This in-kind support is valued at approximately $900,000 over 2 years. Teams will also be able to access up to $60,000 of trainee support and $10,000 in monetary funding over a 2-year period.
SCPOR supports also include access to data sets and information around data collection methodologies, as well as support to use these data sets and collection methodologies, support to engage patient partners and communities, and financial support and facilitation help for team meetings.
SCPOR supports include training opportunities for teams and individuals, building research relationships with First Nations, Métis and Inuit communities, budgeting and facilitating meetings, understanding research processes and how everyone can engage in them, and more. All projects will include the collection of PROMs and PREMs, so projects will support the improvement of patient outcomes and experiences.
PROMs are patient-reported outcome measures. These are self-reported measurement instruments that patients complete to provide information on aspects of their health. PROMs include areas that may impact an individual's quality of life. This information is used to provide insight into the effectiveness of care. For example, it could include symptoms, functioning capacity, physical, mental, and social health. PRIMs are patient-reported experience measures. These are self-reported measurement instruments or questionnaires that patients complete to provide information about their satisfaction with and experience of receiving healthcare. PRIMs focus on the process of care and how they impact the patient's perception of their experience. PRIMs are usually used to evaluate and monitor service quality.